I'm Dr. Rebecca Proudfoot and I'm a paediatric consultant in York Hospital. This video is to give you some information about Group A Strep, how it can affect your child and how you can look after them at home and when you should seek medical attention. Group A Streptococcus or Group A Strep is a type of bacteria and it's found in the skin or in the throat of around 1 in 5 school-aged children. It doesn't usually cause them any harm, and if you find Group A Strep on a throat swab, it doesn't always mean that the child actually has an infection. Group A Strep is spread by coughing and sneezing and can be found on hard surfaces for a short time, such as door handles. When your throat does become infected with Group A Strep, you can get tonsillitis. Now, your tonsils are tissues at the back of your throat that become swollen and enlarged when you have an infection. Group A Strep can live there, but so can a lot of viruses. And in fact, the most common cause of tonsillitis is a virus. Symptoms of throat infections include fever, really sore throat, difficulty swallowing, headache, feeling tired and generally unwell. It can be really hard to tell viral from bacterial sore throats. Features that are more suggestive of a bacterial infection include a temperature that doesn't resolve after a few days, enlarged lymph nodes, particularly in the neck, and red tonsils with pus on them. It's important that if your child has these symptoms, you go and see your GP. Your GP is likely to want to take a throat swab, but unfortunately the results aren't available immediately. Nonetheless, your GP will probably prescribe antibiotics if they think Group A Strep is likely. Scarlet fever is a reaction to Group A Strep throat and skin infections. It typically starts with a sore throat, headache, fever and feeling generally unwell, and then a few days later a rash develops, initially on the chest and the abdomen and then spreading to the limbs. The rash tends to be red with a sandpapery, rough feeling. This can be harder to appreciate in dark skin tones, but the sandpaper rough feeling should be the same. Another feature of scarlet fever is a swollen red tongue, sometimes with a white coating, and this can be described as strawberry tongue. Scarlet fever can be very mild and resolve by itself. However, if your GP suspects scarlet fever, they will usually prescribe antibiotics and your child should stay at home for at least 24 hours. We use a traffic light type system to try and assess the severity of your child's illness. Please call 999 or take your child straight to A&E if they have any of these red criteria. These include difficulty breathing, such as making grunting noises or sucking in their stomach whilst they're breathing, having pauses in their breathing, becoming blue, particularly to the lips and the tongue, becoming floppy and difficult to wake up or will not stay awake, any area of severe pain in their body, and any painful red area on their skin, particularly if it is increasing in size. Please call 111 or see your GP the same day if your child has any of these amber features. These include you feel they're getting worse or you're worried about them, they've passed urine less than twice in the last 12 hours, their fluid intake is less than half that it would usually be, or they're very tired or irritable. Some conditions might mean that your child is more at risk of serious infection and you should have a lower threshold of bringing them to see your GP or taking them to A&E. This includes children who were born extremely prematurely, those who are less than 12 weeks old, and those who have lung and heart problems and have any problems with their immune system. If your child has no amber or red features, they can be safely cared for at home. Most sore throats get better without any specific treatment. Painkillers can help, but they won't make the underlying illness go away any more quickly. Ensure they get plenty of rest and drink lots of fluids. Don't worry too much if they don't want to eat any solid food. Just ensure they are getting a little bit of sugar by using squash with sugar or dilute apple juice. We hope that you found this video useful and it helps you to look after your child at home and know when to seek medical advice.